As we all know, the COVID-19 pandemic has placed unprecedented strain on health and social support systems globally. In Victoria, in particular, we've had to endure long, protracted lockdowns. Our research attempts to answer how these changes have impacted people living with HIV, a group who already experience higher than average levels of comorbidity, mental health issues, food and accommodation insecurity, and stigma. Our team worked very closely with key community HIV advocacy groups such as Living Positive Victoria, Positive Women Victoria, and the National Association of People with HIV Australia, or NAPWA, to design an online survey trying to find out how exactly the COVID-19 pandemic was affecting people living with HIV in Victoria. Questions included access to medical care, as well as impacts on employment, income, and accommodation. We also explored mental health and how the pandemic and the lockdown were affecting everyone's personal relationships. We then sent out the survey on social media and also advertised it in infectious diseases clinics at Alfred Health and Monash Health. Our study found that people living with HIV had been negatively impacted by the pandemic in a multitude of ways. In particular, large groups of respondents reported that their employment and personal relationships in particular had suffered greatly. There were also reports of weight gain and increased levels of substance use during the pandemic. Our patients also reported being very worried about the impacts of the pandemic on their physical health, mental health, and financial situation. On a more positive note though, we found that HIV care and other medical care continued largely uninterrupted, assisted by telehealth, which was pretty well received. It is our hope that this research helps inform HIV providers on how best to support their patients and be an advocate during this challenging time.